Dr. Rosemary Aldo is the Deputy Director of Research. She has a PhD in medical microbiology with virology specialty. She joins us today. Her research interest includes HIV, viral hepatitis, human papillomavirus. She's been involved in training and providing proficiency panels for HIV, TB, and malaria. She joins us in the studio. She's also a member virologist, the Nigerian Institute of Medical Research. That's IMR. Thank you so much, ma'am, for joining us on the program.
It's a pleasure.
I hope I got all that right, and I'm sure many more.
That's okay.
All right, tell us how far medical research, or rather the institute now in Nigeria, has gone in terms of identifying first the type of strain of COVID-19 that we have.
All right, thank you very much. I'm quite excited that we are involved in this pandemic, response to this pandemic. It all started last year, 2019, when 2 of our staff went to China to train on some techniques. And then we had 3 other staff that went to Institute Dakar in Senegal, also to train just for technology, skill acquisition. And as soon as they came back, by November, we had to come together and see how we could prepare for any viral outbreak in Nigeria. You know, it was in getting that ready, getting the kits and all the primers ready. You know, we didn't know, COVID had not been announced then, and suddenly we heard that there was this outbreak early in January of coronavirus outbreak in China. And since we already were collaborating with China, we were able to get some test kits, and we already had primers, we're just ready. So when the index case was announced, NCDC, at that time, my Director General had gotten in touch with the minister to say, NIMA is prepared to respond to this outbreak. So we got some sample from this index case. We tested, it was positive, so our kits were okay. And then we went ahead to sequence it. And within 3 days, we completed the sequencing. It was a part genome sequencing. And we found that the strain that we had had 98% similarity with the one that was reported in China. And after this, we have been sequencing, you know, monitoring the sequence to see if there is any change. But we have found that it's a conserved region. It's not changing as such. It's not mutating. So we are monitoring to see if it's mutating because, of course, it's going to impact diagnostics and it's likely going to impact treatment. So we just need to keep monitoring. As we speak, we will soon upload our full genome sequence, sequencing the entire virus from one end to another, just monitoring, and this we intend to do. This is our own contribution. And then in doing that, we also had companies contacting us, even before the first index case was reported, that they had some workers from China that had arrived. We should please screen them to know that they are free of coronavirus. That we were doing, and we had some NGOs partner with us to install this, to establish a drive-through. We modified it a little. It's a drive-through and a walk-through facility for sample collection. So we collect samples and we test. Within 24 hours, we release the results. And then
That's just in Lagos?
In Lagos, in our institution in Lagos. So that's part of the response we have had. And along the line also, at the Nigerian Institute of Medical Research, because we were collecting samples, we were preparing our own transport medium. And later on, we discovered that at the national level, they had run out of this transport medium. Importing these items are really very difficult because the whole world is asking for it at the same time. So we now are producing viral transport medium for this outbreak. We're supplying to other institutions who ask for it.
Across Nigeria.
Yes, across Nigeria.
There's something a number of people are witnessing, and some people are wondering, because we're having like a lot more health workers infected with the virus, and many people are wondering now, is it that there is scarcity in the PPEs or diagnostic tools, or what we're getting are actually inferior and they're not protecting our health workers?
Thank you very much. You must know that this virus spreads really, really fast. And I must tell you that the PPE that they wear, when a scientist dons on it or a doctor dons on it, it costs 45,000 naira, just one wearing it, And if 4 or 5 people wear it, you can see it's quite expensive. The quality we have is the standard quality, but it's expensive. And I guess it's because we have NGOs partnering with us that we're able to get the supply, and some more people are coming to support us. But in facilities, and apart from that, you are an institution that wants to respond to COVID outbreak is necessarily required to do a risk assessment before starting. It's encouraged. You do a risk assessment, see your system, where do you think you have gaps, and then you provide solutions to breach the gaps. And the infection prevention and control system must be in place, whereby they monitor even the health workers. Like in our facility, for instance, our infection prevention control team, they monitor us daily. We have forms that we have to check. If there is any symptom, immediately you go test and all of that. So it's close monitoring. Those who collect the samples, after collecting from 5 people, for instance, they come spray around. So it's intensive. You just need to, it's a battle, I just say. It's an invisible one. You don't get to see. Many people, some people say they don't believe it. It's unfortunate, but it's just we're fighting an invisible battle. So we just have to be really prepared.
We have a few minutes before we let you go, and I just wanted to quickly get the latest on the test trials on the efficacy of chloroquine. I understand the Institute was working on that.
Yeah, we are working on that. We have gotten an approval. The Institute is working together with Lagos State on this. They are yet to start administering these drugs in the trial, but it's about to commence. Any moment from now, it will commence.
All right, we appreciate your time. Professor Rosemary Awodu, virologist with the Nigerian Institute of Medical Research. Thank you for joining us on the program.
It's a pleasure.